have blackheads on your nose that just won't go away? Have you tried squeezing them, using pore strips, or using those viral pore vacuum devices? And they still keep coming back. Hi, I'm Dr. Chiyen. I'm a doctor working in Malaysia with special interest in dermatology. Today, I am going to show you what blackheads actually are, what treatments actually works according to the latest research, and exactly how to use comedone extractors safely if you choose to remove them. Let's start with the basics. What are blackheads? Blackheads, medically known as open comedones, are one of the two types of non-inflammatory acne lesions along with whiteheads, closed comedones. Here is what happens. Your sebaceous glands continuously producing oils, sebum, to keep your skin lubricated and moisturized. Normally, this oil travels up the hair follicles and exits onto the skin surface. But sometimes, the process goes wrong. When the skin cells at the top of the follicle don't shed properly, they create a plaque. Oil, bacteria, and dead skin cells get trapped inside. If this plaque is covered by a thin layer of skin, it appears white. That's a whitehead. If the plaque is open to the air, the trapped oil oxidizes. It turns black or dark. That is your blackhead. Here is what I want you to understand. Blackheads are normal. They are a natural byproduct of your own skin's oil production, a normal secretion from the skin. Everyone has them, including your partner, your friends, and even your skin doctor. But if they bothered you, there are safe and effective ways to manage them. So what actually works for the blackheads? Let's look at the evidence. First, topical retinoids. Topical retinoids are considered first-line agents for treating comedone acne. They work by normalizing how your skin cells shed, preventing that plaque from forming in the first place. A systematic review found that retinoids such as Adapalene and tretinoin can significantly improve both open and closed comedones. Adapalene is a third-generation retinoid available over the counter, and it is excellent for blackheads. Second, salicylic acid. Salicylic acid is a beta-hydroxy acid that penetrates into the pore and helps to dissolve the debris inside. A 2023 study found that the effect of salicylic acids on various forms of acne didn't peak until second week, with visible reduction in blackheads. Third, chemical peels. A systematic review found that salicylic acid peels are effective in reducing open comedones. Fourth, blue light therapy. A clinical study found that self-applied blue light therapy can significantly reduce the total number of open comedones on the face, with significant reduction by day 7 and day 28. Blue light is the only treatment that I have not tried yet personally. I'm planning to make a video reviewing blue light therapy in the future. If you are interested in this kind of video, please remember to subscribe to my channel. So the key takeaway from the research studies that I have learned so far, the most effective approach is combination therapy. Use a topical retinoid at night and salicylic acid in the morning. Be patient. Result takes 4 to 12 weeks. Blackheads don't disappear overnight. How to use a comedone extractor safely. Now, let me show you how to use a comedone extractor safely if you choose to remove blackheads at home. The tool that I am talking about is a comedone extractor. It is a precise instrument with a small loop or spoon-shaped end that applies even pressure on the blackhead. A comedone extractor is a pin-shaped tool that features a hole. After applying physical pressure to the pore, you can extract clogged materials through the hole. The circular opening distributes pressure evenly on the follicle. Here is my step-by-step process. Step 1. Cleanse the skin. Start by thoroughly cleansing the area with a gentle cleanser and warm water to remove surface oil and dirt. Step 2. Soften the skin. Apply a warm compress or use gentle steam to help open up the pores and soften the contents. This makes extraction easier and less traumatic. Step 3. Sterilize the tool. The comedone extractor must be properly sterilized with alcohol. Step 4. Position the extractor. Place the loop around the blackhead, not directly on top of it. The blackhead should be centered in the opening. Step 5. Apply gentle, even pressure. Press down gently and roll or slide the extractor across the blackhead. The pressure should be even and controlled, not forceful. If the blackhead doesn't come out with gentle pressure, it is not ready to be extracted. Step 6. Cleanse again. After extraction, cleanse the area again and apply a soothing product to minimize redness. After blackheads extraction, your pores are essentially micro wounds, making freshly extracted skin highly vulnerable. To prevent irritation and scarring, immediately soothe the area with cooling gel masks, hydrating serums, and repairing Cica balms that contain aloe vera, panthenol, and hyaluronic acid. I usually apply a thin layer of a cooling gel mask post-extraction, leave it on for 10 to 15 minutes and rinse thoroughly with cold water. Here is what makes these tools effective. When you squeeze using your finger, you are applying uneven pressure. It can damage the surrounding skin, cause bruising, and even rupture the follicle wall. The comedone extractor applies even pressure, which is much safer. And here is the most important thing. Extraction only removes the current blackhead. It does not prevent new ones from forming. That's why I always combine extraction with a proper skincare routine with topical retinoid or salicylic acid. Why you should not squeeze at home. Now, let me tell you what not to do. Do not squeeze your blackheads using your fingers. Here is why. Squeezing a blackhead can irritate the skin, introducing bacteria into the pore, and push the blockade deeper into the skin, which can worsen the problem. When you squeeze with your fingers, you are applying uneven pressure. This can damage the surrounding skin, cause bruising and broken blood vessels, rupture the follicle wall, which can lead to inflammation and scarring. What about pore strips? Pore strip can remove some of the surface level of blackheads, but they are not a long-term solution. They can also strip away your skin's natural protective barrier and cause irritation. The aggressive yanking motion can permanently enlarge your pores and even break the blood vessels around your nose. What about pore vacuum devices? I see this all over social media. At-home pore vacuuming devices can cause bruising, skin irritation, micro tears, and broken blood vessels. They can be very irritating, especially for sensitive skin. My advice, if you want extractions, do them safely. Use a sterilized comedone extractor with gentle pressure. Here is the honest truth about blackheads. They will always come back. Why? Because blackheads are a normal secretion from your skin. Your sebaceous glands will continue to producing oil, and that skin cells will continue to accumulate. You cannot remove them permanently. And here is something else I want you to hear. No one look at you the way you look at yourself in the mirror. Think about it. When was the last time you looked at someone's nose 2 centimeters away from it? Never, because that is not how human beings interact. We interact from a social distance, at least an arm length away. From that distance, your blackheads are invisible. But when you hold the mirror just 2 centimeters away from your face and tilt your head just right, suddenly you see pores, you see blackheads, you see flaws that literally no one else can see, not your partner, not your friends, not even your mother, only you. And if you obsess over these tiny normal skin features, you will never be satisfied. Even if you had no pores, you would find something else to worry about. Here is something that I want you to remember. Blackheads are a normal part of having skin. They are not a sign of poor hygiene. They are not something to be ashamed of. And honestly, the more you squeeze and pick at them, the more you damage your skin. You can actually make your pore larger and create permanent scars. So let me bring everything together. Blackheads are a normal part of your skin oil production. They are not a sign of poor hygiene. If you want to manage them, use evidence-based treatments. Topical retinoids and salicylic acids are your best friends. If you choose to extract them, do it gently. Use a sterilized comedone extractor with a gentle, even pressure. Don't squeeze using your fingers. Be consistent. Results take time. Don't give up after 2 weeks. Be kind to yourself. No one is looking at your nose as close as you are. Blackheads are normal. They come and go. That is just how skin works. Remember, you cannot remove them permanently, and that is okay. It is completely normal. I myself also have had blackheads myself. They are part of having skin, especially oily skin. As long as they are invisible within social distance, I am okay with it. If you found this video helpful, hit like and subscribe. I'm Dr. Chiyen. I make videos about acne, skincare, and dermatology. Drop a comment below. What is your biggest struggle with blackheads? I love to hear that. Thanks for watching. Take care of your skin. You're beautiful with or without blackheads. See you in the next one.